You're volunteering?
Ann always volunteers.
Go Ann, say
She's
hi.
forced into it. I think it's peer pressure.
Broken.
You're recording now?
Yeah, I am.
Right there.
She's like,
She's not a bad
I looked at it twice and it never. I'm gonna do that too.
All right, so you're going to do AFP line, SC, we want the patient supine.
you're on candid camera, so. You guys think
Smile.
The patient is supine, and let's just say your chart says, A to P glide of the right SC joint, right? So what you're gonna do is, you're gonna stand on the right side, here. Patient turns their head away. If it's a female, they use their breast protection. I'm gonna grab the patient's upper portion of her arm. I gotta find the medial 1/3 of the clavicle. Take a hypothenor context. I'm gonna take a little bit of tissue pull, just hold down a little bit. A little bit of tissue pull here. I grab the arm here. There's a broad contact here. As I pull this way, I'm going to pull the arm here at the same time, pull here. You can see I get myself up over the patient, and then impulse A to P.
Feels
That's-
good, doesn't it?
Like that would be your impulse.
Well, maybe a little bit more than that.
Okay.
Since she's in a demo, I'm
Yeah.
not doing the wall hard on her. But, yeah, but show us that you're doing something. I mean, don't just, you say, okay. No, I mean, that's what you're saying, I mean, we can mark off. I mean, get it, shows that you're taking tissue pull, you're getting in the joint, you're gonna give, do something, I mean, don't worry about cavitating. But show that you mean something. All right, so now, do you want me to go through all four and then we pair up?
Yeah.
Oh, yeah.
All right.
Yeah.
Is it always one impulse that we're throwing in, or is it?
Well, figure one impulse. So unless it's,
One.
I'll show you if it's more than one.
Okay.
Usually it's one. All right, so then we can do P to A glide. So if it says P to A glide of the right SC joint. Patient turns their head. No. Run away. Arm is here. Right, arm is neutral here. Breast protection. I'm going to use the couple of fingers, and which fingers you're going to use depends the size of your fingers and the size of their supraclavicular fossa. So I'm going to tend to use these last couple of fingers here to try to get in here. As you want to try to grab that behind the medial 1/3 of the clavicle. I'm going to grab her arm. As I raise her arm up this way, which would be, I guess, flexion, I'm going to also add a little distraction to the arm at the same time, where I'm then reaching underneath here and pulling. Right? This one you're going to do a few times, and to show that you're doing, this is, again, a mobilization. Right? Okay. Then we have our S to I glide. And then I got to stand over here. So I'm going to stand here.
You guys gotta move.
Turns their head. And what I'm going to do is S to I glide.
Don't be nervous on camera.
Again, breast protection. And I'm going to use a hypothenor contact. Find the medial 1/3 of the clavicle. Nicholas out of the way. Take a little tissue pull here. You see I turn my fingers away so I'm not all the breast tissue. I'm going to grab her arm here. I'm hanging off this platform, but as I raise her arm up, I'm going to add some pressure down this direction. And when I kind of get to the 90, a little bit above the 90, I would impulse, right? That's the I. Right? Adding this pressure and then impulsing. All right? And then we have our I to S glide. Bring the scoots closer to you. Right? And then what I'm going to do is, she's got the breast protection. I'm going to abduct her arm. And first I would ask the patient, could I take your elbow and put it between my knees? Consents to that. So I come here, and I'm going to scoot my body back this way. And I'm going to take my lateral hand. I'm going to get under the medial 1/3 of the clavicle. Let's pull that down a little bit. Here. I'm going to reinforce with over my thumb with my hypothenor. As I distract with my legs here, I can try to hook up underneath a little bit more, and I'm going to drive I to S. I'm underneath the bone trying to push this direction. All right?